Assalamu alaikum. আমি Dr. Farjana Khanam, সহকারী অধ্যাপক, Anatomy Department. Today our topic is cerebellum, the very important part of brain which control and equilibrate our posture. Cerebellum, the word, it comes from Latin word and the meaning is the little brain. In this picture we see the cerebrum and the cerebellum. Here is the different sulcus gyrus of the cerebrum, then cerebellum, pons and medulla. Cerebellum, the little brain. As a whole, the function of the cerebellum is coordinate movements, control posture, balance and fine motor movements involved in motor learning. Gross anatomy of the cerebellum, the location. The location of the cerebellum lies in posterior cranial fossa and it is in the hindbrain. It is a part of hindbrain, lies in the posterior cranial fossa. It is also present behind the pons and medulla oblongata, separated from two structure by the cavity of fourth ventricle. এর মানে হচ্ছে cerebellum hindbrain-এর একটি অংশ এবং এটি সাধারণত posterior cranial fossa-তে থাকে, যেটি pons এবং medulla oblongata-র পিছনে থাকতেছে. In between pons and medulla oblongata and the cerebellum there is a cavity called fourth ventricle. So it is separated from pons and medulla oblongata by the cavity of fourth ventricle. Then what is the covering of cerebellum? Is there any dural fold present in the cerebellum? Yes. The superior surface of the cerebellum is covered by a dural meningeal dural fold that is called tentorium cerebelli and is connected to the brainstem by 3 cerebellar peduncle. And what is about the weight? In adult, the ratio of cerebrum and cerebellum is 10:1 and in neonate or infant it is 20:1. Again, we have know the gross anatomy of the cerebellum. First, location. It is located in posterior cranial fossa. It is a part of hindbrain and it is separated from the pons and medulla oblongata by the cavity of fourth ventricle, and it is covered by tentorium cerebelli and is connected to the brainstem by 3 cerebellar peduncle. There is a picture where we see the tentorium cerebelli, cerebellum, arbor vitae cerebelli, later we describe about it, and the pons and medulla oblongata. In between pons, medulla and cerebellum there is cavity that is called fourth ventricle and it lies in the hindbrain. It lies in posterior cranial fossa just in front of the occipital bone. What about the surface and border and lobes of the cerebellum? First we discuss about the surfaces of the cerebellum. There is 2 surfaces present in cerebellum, one is superior surface, another is inferior surface. The superior and inferior surfaces are separated by horizontal fissure. This is very important. Again I repeat the sentence, the superior and inferior surfaces are separated by horizontal fissure. And what about the superior fissure? It is a convex part of the superior surface is convex in outline and in between superior surface of the 2 cerebellar hemisphere there is a part that is called vermis. It is continuous laterally with the cerebellar hemisphere. So inferior surface, in the midline it is deeply grooved called vallecula separating this hemisphere. Inferior vermis lies in this vallecula. So again we say what about the superior and inferior surface, the demarcation point. Superior surface is convex in outline, but the inferior surface is usually flat and there is a median vermis in superior surface by which the superior surface of both cerebellar hemisphere are connected. In inferior surface, the both cerebellar hemisphere are not connected due to there is presence of deeply grooved called vallecula. In this vallecula there is inferior vermis present. Here is a picture we see the superior surface of the cerebellar hemisphere. right and left cerebellar hemisphere shows the superior surface, and the red marked area is the vermis or superior vermis, and there is a notch, that is anterior cerebellar notch, which is wide, but there is a posterior cerebellar notch which is narrow and deep. Here the dividation of the surfaces or lobes later we discuss. In this picture we see the inferior surface of the cerebellum. The inferior surface of the cerebellum is usually flat, and there is a deep groove called vallecula. The red mark is area called vallecula. Here the inferior vermis lies, and there is anterior cerebellar notch, posterior cerebellar notch. What about the fissure and lobes? This is very important topics for the cerebellum. In viva it is usually asked what are the fissure and lobes. Cortex is thrown into numerous folds called folia, separated by 3 prominent fissures. Again I repeat the word, cortex is thrown into numerous folds called folia. কর্টেক্সটা অনেকভাবে ভিতরের দিকে ভাঁজ হয়ে থাকে, যেটাকে আমরা অ্যানাটমিতে টার্মে বলি ফোলিয়া, এবং এই ফোলিয়া বা এই যে ফোলিয়াগুলো সাধারণত ফিশার দ্বারা ভাগ হয়ে থাকে। There are different fissure, but 3 is very important. That is called primary fissure or fissura prima, horizontal fissure and posterolateral fissure. And there is 3 lobes: anterior lobe, posterior lobe and flocculonodular lobe. Here the horizontal fissure, this horizontal fissure is used only to separate the superior and inferior surface, but not to divide into lobes. Again তাহলে আমরা এটা বুঝলাম হরাইজন্টাল ফিশার দিয়ে আমরা সুপিরিয়র এবং ইনফিরিয়র সারফেসকে আলাদা করব, কোনো লোবকে নয়। তাহলে আমাদের কয়টা লোব এবং কয়টা ফিশার থাকতেছে সেরেবেলামে? ইন সেরেবেলাম দেয়ার ইজ 3 ডিপ ফিশার, দ্যাট ইজ কল্ড প্রাইমারি ফিশার or fissura prima, horizontal fissure and posterolateral fissure, and there is 3 lobes, that is anterior lobe, posterior lobe and middle lobe. আমরা এখানে একটা কথা বলবো, সেটা হচ্ছে horizontal fissure separate the surface, not the lobe. So how the lobe is separated? The lobe is separated by anterior lobe, middle lobe and flocculonodular lobe. In between anterior lobe and middle lobe there is one fissure present, that is called fissura prima. In between middle lobe and flocculonodular lobe there is one fissure present, that is called posterolateral fissure. So it is very important about the lobe. From these topics we know about the surface, lobe and fissure of the cerebellum and location and gross anatomy of the cerebellum. Thank you very much, and inshallah in next class we will discuss about the further of the cerebellum.